Because cancer screening is so important, we want to make it as easy as possible. And there's no better way to do that than to give people the option of screening at home.
So HPV, or the human papillomavirus, is the most common sexually transmitted infection. 80% of people will clear HPV on their own, but for the 10 to 20% of people that hold on to it, that's where the risk of cervical precancer or cervical cancer comes.
A key goal of the Cancer Action Plan is to eliminate cervical cancer. Globally, it's the fourth most common cancer for women.
The new test is an HPV swab. It's a viral test. It's objective, so you get a yes or no answer. And because it's a viral swab, it doesn't need to be a physician-collected swab. It can be if a patient chooses, but this new swab gives patients autonomy, which means if they want to do a self-collection, they can.
BC is really leading the way in Canada in giving people that option. Any woman or person with a cervix can go online or call BC Cancer Cervix Screening Program and order a test kit. That test kit will then be mailed to your home and you can do the test. And then there's a prepaid envelope and you can mail it back. Then they'll follow up and let you know the results and connect you, if need be, to a primary care provider in your community if you don't have one.
It enables those that have any barriers to screening to do it in the comfort of their own home, and it will ultimately improve access and improve equity.
There were so many moving parts that had to be synchronized, and all of this led by BC Cancer Cervix Screening Program.
I'm most proud of the ability of the entire system to come together to produce this product. Patients need to be educated, healthcare providers need to be educated. In order to be able to engage minority groups, we worked very closely with Transcare BC. We worked closely with the First Nations Health Authority, including the Carrier-Sakani First Nation.
I've gone through a lot of trauma in my life with racism and sexual abuse and a lot of barriers in terms of like access. And for this to be available to our women, especially for our remote communities, is so amazing.
It used to be that in order to get the test done in the screening program, you had to have a primary care provider. That is no longer the case. That was a big change. It was something that had never been done before. But now that we have done it, it's something that we can apply to the remaining screening programs.
Patients' feedback has been overwhelmingly positive. We saw that with the really high initial demand for cervix self-screening.
It was a game changer for me. It was a life changer for me. They did find abnormalities, but the follow-up was immediate.
The province was ready for this transition, and the collaboration of multiple partners has made that transition for them really seamless.